The conventional approach to aging and joint pain operates on a fundamentally flawed premise. The assumption that the degradation of cartilage, the swelling of the synovial capsules, and the agonizing morning stiffness experienced by individuals over the age of 60 are simply the inevitable consequences of mechanical wear and tear. We are told that the human chassis is merely breaking down due to decades of use. However, modern clinical immunology and gastrointestinal pathophysiology reveal a much darker and more complex reality. For a vast segment of the aging population, chronic joint pain is not a mechanical failure, but a state of systemic, food-borne immunological warfare. The primary antagonists in this biological conflict are not processed sugars or trans fats, but rather the very items society universally classifies as the pinnacle of health, a specific family of vegetables known as the Solanaceae. Commonly referred to as nightshades, this botanical family includes tomatoes, white potatoes, eggplants, and all varieties of bell and chili peppers. To understand why a seemingly innocent tomato salad or a baked potato can trigger an autoimmune firestorm inside the joints of a 60-year-old, we must strip away the culinary romance of vegetables and examine the brutal, evolutionary biochemistry of plant defense mechanisms. Plants are stationary organisms. Because they cannot flee from predators, they have evolved over millions of years to synthesize highly sophisticated, microscopic chemical weapons designed to paralyze, poison, or disrupt the cellular biology of anything that attempts to consume them. The nightshade family is particularly heavily armed. Their primary lines of defense are a group of carbohydrate-binding proteins known as lectins and a highly toxic class of chemical compounds called glycoalkaloids, specifically solanine, tomatine, and chaconine. When a human consumes these vegetables, they are ingesting a concentrated dose of these defense chemicals. In a young, biologically robust individual in their 20s, the gastrointestinal tract often possesses the resilience to neutralize or pass these compounds, with minimal systemic consequence. The mucosal layer of the stomach and intestines is thick, and the tight junctions, the microscopic protein gates that seal the spaces between the cells of the intestinal wall, are highly secure. However, as the human body crosses the threshold of 60 years, the biological landscape of the gut undergoes a profound shift. The production of protective gastric mucin decreases, the enzymatic capacity of the pancreas wanes, and the overall structural integrity of the intestinal epithelial barrier naturally thins. It is within this vulnerable, aging environment that the nightshades execute their chemical breach. When the lectins from tomatoes or the glycoalkaloids from potatoes enter the aging small intestine, they do not passively digest. Lectins are highly resistant to stomach acid and human proteolytic enzymes. They arrive in the gut fully intact and possess a devastating chemical affinity for the sialic acid molecules that line the human intestinal wall. The lectins physically bind to the receptors on the enterocytes, the cells lining the gut, and aggressively pry open the tight junctions by triggering the release of a protein called zonulin. This creates microscopic physical gaps in the intestinal barrier, a condition clinically defined as increased intestinal permeability, or leaky gut. This is the critical moment the biological disaster initiates. Because the barrier is breached, large undigested plant proteins, glycoalkaloids, and bacterial endotoxins bypass the normal digestive filtration system and flood directly into the systemic bloodstream. The human immune system, which has approximately 70% of its functional capacity, stationed immediately behind the gut wall, detects these foreign plant proteins in the blood. The immune system does not recognize a tomato or an eggplant. It only recognizes an alien protein sequence that does not belong in the sterile environment of the vascular system. Immediately, the macrophages and dendritic cells sound a systemic alarm, initiating a massive, generalized inflammatory response and releasing a cascade of pro-inflammatory cytokines, specifically tumor necrosis factor alpha and interleukin-6. This systemic inflammation is the precursor to the localized joint trauma, which is driven by a terrifying biological phenomenon known as molecular mimicry. The immune system operates by creating antibodies designed to seek out and destroy the specific protein sequences of the invading nightshade lectins. However, the amino acid sequences of these plant proteins bear an uncanny, almost identical structural resemblance to the glycoproteins and type II collagen that form the cartilage, ligaments, and synovial fluid of human joints. When the immune system dispatches its antibody army to hunt down the tomato and potato proteins circulating in the blood, these antibodies arrive at the knees, the hips, and the knuckles. Confused by the structural similarity, the antibodies mistakenly identify the healthy joint tissue as the foreign plant invader. The immune system launches a violent, targeted attack against the body's own joints. This cross-reactivity is the exact biochemical engine of autoimmune arthritis. The heat, the swelling, and the deep throbbing pain experienced in the joints after eating nightshades are not the result of mechanical friction. They are the physical sensations of your own white blood cells releasing destructive enzymes that actively dissolve your cartilage and inflame the synovial membrane, an attack entirely orchestrated by the specific proteins found in the healthy vegetables consumed hours earlier. The devastation within the joints is aggressively compounded by the glycoalkaloids, particularly solanine, which is highly concentrated in white potatoes and eggplants. Solanine is not merely an inflammatory agent, it is a known neurotoxin. Its evolutionary purpose in the plant is to act as a natural pesticide by disrupting the nervous system of insects. In the human body, solanine acts as a potent inhibitor of an enzyme called acetylcholinesterase. This enzyme is crucial for the regulation of muscle contractions. It breaks down acetylcholine, the neurotransmitter that tells a muscle to contract. When solanine inhibits this enzyme, acetylcholine accumulates in the neuromuscular junctions, preventing the muscle from relaxing. For an aging adult, this manifests as chronic, unyielding muscle stiffness, cramping, and severe tension in the tendons and ligaments. The knee or the hip feels locked, not just because the cartilage is inflamed, but because tissues are in a state of microscopic spasm. As hepatic and renal clearance rates naturally decline with age, the 60-year-old liver and kidneys struggle to filter these alkaloids. Solanine is lipophilic, meaning it has an affinity for fat and soft tissues. It accumulates in the body over years. This creates a chronic, low-grade toxic burden that makes the joints perpetually stiff and the muscles resistant to relaxation. This leads to the classic morning stiffness that many older adults erroneously accept as a normal part of getting older. There is an additional, highly specific metabolic disruption unique to the nightshade family that directly threatens the skeletal structure of older adults. This is the dysregulation of calcium metabolism. Certain nightshades contain compounds that stimulate the overproduction of calcitriol, the active hormonal form of vitamin D. While vitamin D is essential for health, an unnatural overabundance of active calcitriol forces the body to pull calcium out from the bones and deposit it into the soft tissues. For those at risk for osteopenia and osteoporosis, this forced calcium extraction weakens the skeletal matrix. More devastatingly, this displaced calcium must go somewhere. It settles into the inflamed synovial tissues, the joint capsules, and the surrounding tendons. This process is known as calcinosis or soft tissue calcification. The joints literally begin to turn to stone from the inside out. The grinding friction experienced when walking or bending the fingers is frequently exacerbated by these microscopic calcium deposits, rendering the joint physically rigid and exceptionally painful to mobilize. To break this cycle of self-destruction, the medical intervention requires a complete and uncompromising cessation of all nightshade consumption, a protocol that yields profound, clinically observable transformations, typically within a 30-day window. When tomatoes, white potatoes, eggplants, and peppers are entirely removed from the diet, the chemical assault on the intestinal epithelial barrier immediately halts. Without the aggressive binding of lectins to the intestinal wall, the enterocytes are granted the biological opportunity to regenerate, and the tight junctions reseal. As the intestinal permeability is resolved, the microscopic leaking of foreign proteins into the bloodstream ceases. The immune system, no longer provoked by a constant influx of plant antigens, rapidly dials down its systemic alarm. The production of pro-inflammatory cytokines plummets. More importantly, the antibodies responsible for the molecular mimicry lose their target. Without the structural triggers from the nightshades, the immune system calls off its attack on the type 2 collagen of the joints. The synovial fluid, which had been thick with inflammatory debris and immune cells, begins to clear. The reduction in localized inflammation allows the joint capsule to depressurize, drastically reducing the swelling and the heat. Simultaneously, as the body gradually clears the accumulated solanine from the tissues, the inhibition of acetylcholinesterase is lifted. The muscles and tendons surrounding the joints regain their ability to fully relax, significantly expanding the mechanical range of motion. This protocol resolves the agonizing morning stiffness, allowing for a life of fluid, pain-free movement once again. For individuals over the age of 60, embracing this dietary elimination is often the difference between a life of increasing pharmaceutical dependency and a life of retained functional mobility. If the culinary desire for these foods is too great to abandon entirely, one must utilize precise preparation hacks to disarm the botanical weapons. Lectins are predominantly concentrated in the skins and the seeds of the plants. By meticulously peeling tomatoes and bell peppers, and meticulously scooping out every seed, the lectin load is significantly reduced. Furthermore, utilizing a high-pressure cooker can partially denature the lectin proteins, altering their three-dimensional structure enough to prevent them from binding to the intestinal wall. However, it must be noted that glycoalkaloids like solanine are highly heat-resistant and will survive both boiling and baking. Therefore, the absolute safest, most medically sound strategy is to substitute these inflammatory plants with biologically inert alternatives. The white potato, a nightshade heavily laden with solanine, can be seamlessly replaced with the sweet potato, a member of the morning glory family that possesses a radically different, highly anti-inflammatory biochemical profile, rich in safe starches and beta-carotene without a trace of solanine. Ultimately, realizing that joint pain is not a structural inevitability, but an active, ongoing immunological reaction, changes the entire paradigm of aging. It shifts the power from the surgeon's scalpel and the pharmacist's anti-inflammatory medications directly back to the dietary choices of the individual. By understanding that the plant kingdom utilizes sophisticated chemical warfare to survive, and by respecting the fact that the aging digestive and immune systems can no longer withstand this daily barrage, the individual can make targeted, strategic eliminations. Stopping the consumption of the nightshade family is not a dietary restriction. It is the deliberate cessation of friendly fire within your own body. It is the removal of the specific biological triggers that force your immune system to cannibalize your own cartilage, proving that the preservation of youthful, pain-free mobility in our later decades is frequently achieved not by adding more supplements to our routine, but by definitively removing the hidden botanical toxins that currently masquerade as the cornerstones of a healthy diet.